You are currently the only person in this conference.
Oh. Right. So, welcome everybody. Good to have you back. Let's see where we're at. Okay. All right. So, I'm going to pick up where we left off on circulatory system with a discussion of arteries. Right. So, we have to remember that there are three types of blood vessels in the body that are responsible for moving the blood from the lungs to the tissues, and from the tissues back to the lungs via the heart, and those are arteries, veins, and capillaries. Now, arteries always carry blood away from the heart. Okay, veins always carry blood back towards the heart, and capillaries are primarily designed for gas exchange. All right, and as a result, they have extremely thin walls and are very delicate, but have extensive surface area. Okay, the purpose of the capillaries is to allow diffusion of oxygen and nutrients into tissues, while at the same time permitting waste products and carbon dioxide to move from the tissues back into the blood. The arteries tend to carry blood under higher pressure and always in the direction away from the heart, and so they have thicker walls. The veins have thinner walls and bigger lumens, and at any point in time carry the bulk of the blood in the body. So let's take a quick look at arteries and veins. I've got a couple of nice videos that will sort of orient you here.
Another major part of the cardiovascular system. The blood vessels. We've said it once before and we'll say it again. Blood vessels make up the other major part of the cardiovascular system. There are three major vessel types in the body, and these babies have quite a job. All the blood that flows to and from the heart flows through these bad boys. Because they all have different jobs, vessel types differ in length, diameter, and thickness. The three different types of blood vessels are arteries, capillaries, and veins. The walls of all three types of blood vessels contain structures that are common to all three. For instance, the blood vessel walls of most arteries and veins are made up of three layers called tunics. The tunics surround a cavity inside the blood vessel called the lumen. The three tunics that surround the lumen, or opening, are called the tunica intima, the tunica media, and the tunica adventitia.
The tunica intima is the thin innermost layer of the vessel wall. Basically, the tunica intima is just a continuation of the endocardium of the heart wall that extends into all the blood vessels of the body. The cells of this layer are close-fitting and create a slick surface that help reduce friction as blood flows freely and happily through the lumen.
It's easy to remember that the tunica intima is the innermost layer because the prefix in can help you remember inner.
The tunica media is the middle layer of circularly arranged smooth muscle cells and elastic fibers. The tunica media is responsible for the changes in the diameter of the lumen. So the tunica media is pretty much in the driver's seat when it comes to changes in lumen diameter, blood flow, and blood pressure. The muscle walls of the tunica media can contract and relax. This contraction and relaxation changes the diameter of the lumen. With contraction of the tunica media, the lumen decreases. This is called vasoconstriction. When the tunica media relaxes, the diameter of the lumen increases. This is called vasodilation.
You shouldn't have any problem remembering that the tunica media is the middle layer, because media sounds like medium, which kind of means middle.
The tunica adventitia sounds like the most adventurous of the tunics, as if it were responsible for fighting off villains and killing wolves. But alas, it's just the outermost layer of the vessel wall.
The tunica adventitia is covered with nerve fibers. It also may be surrounded by tiny blood vessels called the vasa vasorum. Vasa vasorum carry blood to the tissues which nourish the tissue of the vessel walls. Now tell me that doesn't rip adventure.
So each of the three vessel types, arteries, capillaries, and veins, have similar characteristics. Each of the vessels contain one, if not all, of the three tunica layers. Just like people, dogs, and socket wrenches, these vessel types differ in length, diameter, and thickness. But don't just take my word for it. Why not learn more about vessels from the well-known assassins of our nation's history? Here to tell you more is a poorly animated version of John Wilkes Booth.
As a well-known assassin from our nation's history, I know a lot about the needless spilling of blood. And so, I give thee one of the more lovable and well-known blood carriers, the artery.
The arteries are vessels that transport blood away from the heart. The word artery also starts with the letter A, just like the word away. Typically, arteries have a really large tunica media, which helps the artery control the distribution of blood throughout the body by helping them constrict and expand with the pumping of blood.
A prime example of an artery is the aorta, a huge vessel that takes oxygen-rich blood from the left ventricle and transports it to the rest of the body. I am Charles Guiteau, down with Garfield. Long live the capillary.
That was twisted assassin Charles Guiteau with a cryptic introduction to the capillary.
Capillaries form dense networks found in almost all tissues of the human body. These networks are called capillary beds, and boy are they tiny. The diameter of a capillary is only 8/1000ths of a millimeter, just large enough to let red blood cells pass through single file. Capillaries, unlike arteries and veins, only have a tunica intima. This allows for an easy exchange of gas with bodily tissues. This makes the capillaries pretty handy.
Hello, how are you being? I am Zolgos. I am obscure. And now, the veins. For those of you who had no idea who that was, which is probably everyone watching, it was obscure assassin and funny man Leon Zolgos. And that was a little introduction to veins, another type of blood vessel. Veins have an important job too. They transport blood towards the heart.
Veins have thinner walls and larger lumens than arteries, but that's okay because not as much pressure is exerted on the walls of veins as on the arterial walls. In any event, veins are pretty important. 65% of total blood volume is in the veins every minute of your life. Otherwise, you're dead.
Veins below the diaphragm, that is, veins in the lower half of the body, are equipped with valves. These valves are similar to those found in the heart. Basically, their job is to make sure blood stays on track, happily flowing in one direction towards the heart. This is important in the veins of the lower body because the blood must flow against the force of gravity, so valves keep blood in line and on track.
We're done with blood vessels. Arteries, veins, and capillaries are all there are, so we need no more introductions or assassins. But what we do need to talk about is blood pressure.
You see, blood pressure is the force exerted on a vessel by the blood inside of it. Differences in pressure within the blood vessels are what drive the blood throughout the body.
When we measure blood pressure, we express it in terms of millimeters of mercury. You know, the poison stuff that's inside thermometers. 120 mmHg is the average blood pressure in healthy humans. So if someone has a blood pressure of 120 mmHg, the mm stands for millimeters, and the Hg is the symbol for mercury. So, a blood pressure of 120 mmHg is equal to the pressure exerted by a column of mercury 120 millimeters high. The pressure on the vessel walls is equal to the pressure exerted by that amount of mercury. This may seem strange, measuring blood pressure in terms of a deadly substance, but that's how the doctors do it, so it must be right.
Also related to pressure is the arterial pulse.
You can feel your arterial pulse when you touch your lower arm proximal to or above your palm, in the carotid artery on your neck, and a number of other places on the body.
The arterial pulse is created by surges of pressure in the arteries created by the heartbeat. The heartbeat tells us the heart rate. Blood pressure can be measured by using an instrument called a sphygmomanometer, or blood pressure cuff. I actually call it the arm strangler of doom.
And then, of course, there's the sounds of Korotkov. You can't discuss blood pressure without mentioning the beautiful, beautiful sounds of Korotkov.
My chest is alive with the sound of Korotkov.
Ah, the sounds of Korotkov. These are the sounds that blood makes as it flows through a constricted artery, an artery whose tunica media has contracted and decreased the size of its lumen. These two sounds reflect two types of blood pressure that can be measured. We hear these sounds by using a sphygmomanometer.
Now, before we discuss the sounds of Korotkov, it's important for you to remember what happens in the heart. Ventricles are contracting, pumping blood into arteries and putting pressure on them. When the ventricles contract, this is called ventricular systole. This creates the systolic blood pressure. Now, just after the ventricles contract, when they're relaxed, this is called ventricular diastole. This creates diastolic blood pressure.
When we first hear the sounds of Korotkov, the ventricles are contracting and the left ventricle is creating a lot of pressure in the aorta. This is called systolic pressure. Systolic pressure is normally measured at around 120 millimeters mercury. When the sounds of Korotkov disappear, there's less pressure in the aorta because the left ventricle is relaxing. This is known as diastolic pressure. Diastolic pressure is normally measured at around 80 millimeters mercury.
Unfortunately, there are a number of conditions that go hand in hand with blood pressure. Things like hypertension.
Hypertension is another name for sustained high blood pressure. People with hypertension have a systolic pressure higher than 140 millimeters of mercury and a diastolic pressure above 90 millimeters mercury. This increase in pressure can be caused by a number of factors, but the end result is always the same, an increase in resistance to blood flow in vessels. When the pressure gets higher, it's harder for blood to flow. It's like trying to channel a fire hose into a garden hose.
The scary thing about hypertension is that most of the time it's asymptomatic, meaning it doesn't give any symptoms. That's how it earned its nickname, the silent killer. It's hard to know you have it, but it can result in heart failure, kidney failure, or stroke. There are two common forms of hypertension, primary hypertension and secondary hypertension. Primary or essential hypertension is responsible for about 90% of hypertensive cases. It's somewhat of a mystery in that no one knows what really causes it. There are some who believe that high salt, obesity, stress, smoking, heredity, and old age contribute to primary hypertension, but no one can be sure. It's like the Bermuda Triangle of the cardiovascular system. But fear not. Primary hypertension can be controlled by drug therapy and dietary restrictions.
Less common than primary hypertension is secondary hypertension. This accounts for about 10% of all hypertensive cases. There's no shroud of mystery surrounding secondary hypertension. We know it's caused by things like kidney malfunction, arteriosclerosis or clogged arteries, and endocrine disorders. If you're confused, don't worry. We'll be talking about the endocrine system later on, and you'll understand the word endocrine. Then, you can rewind to this section and say, oh! But for now, just smile and be content that you know the cause of secondary hypertension. I'm Slim Goodbody.
I'm Slim Goodbody.
Good body. Them good body. Did you know the ancient Mayans used blood vessels to make beaded necklaces? Probably not, because they didn't.
That's about it for the cardiovascular system. The heart and the blood vessels will always serve you, proud and true. There is one...
Okay, so this is a tutorial on the arteries of the body.
So I'll cover some of the important arteries that you need to know. So starting from the heart, I'll start with this artery here, the pulmonary trunk, which comes from the right side of the heart and pumps deoxygenated blood to the lungs. The pulmonary trunk bifurcates into left and right branches, so you've got the left and right pulmonary artery. So you can see that there. So the right pulmonary artery, just the aorta. So on the left side of the heart, the left ventricle pumps blood out through the aorta, which arches over the pulmonary trunk. And this level of the arch of the aorta where the pulmonary trunk bifurcates is the level of the angle of Lewis, so the junction of vertebra T4, T5. So the angle of Lewis is where the manubrium of the sternum meets the body of the sternum. So if I just show you that quickly. So this junction here is the angle of Lewis, the sternal angle. So that's the level of the disc between T4 and T5. So the arch of the aorta has three branches coming off, which you can see here. So the first branch is the brachiocephalic trunk. This second branch in the middle is the left common carotid, and this branch here is the left subclavian artery. So you can remember, there's a mnemonic for remembering the branches of the arch of the aorta. So ABCs, as in learning your ABCs. So A, aorta, B, brachiocephalic trunk, C, common carotid, so the left common carotid, and S, subclavian, so left subclavian. So this branch here, this brachiocephalic trunk, then splits into two branches. You've got the right subclavian here and the right common carotid. So just like you've got the left common carotid here, you've got the right common carotid here, which branches off from the brachiocephalic trunk. So just following the common carotid arteries up a bit further, they then split into another two branches. So you've got the internal carotid and the external carotid coming off the common carotid artery. The external carotid artery has loads of branches, and these supply the head and face. So you can see all these arteries on the face. These are branches of the external carotid artery. The internal carotid artery, however, runs straight up to join the base of the brain at the circle of Willis. So it's this arterial circle at the base of the brain which supplies the brain, and the internal carotid goes up to meet that. So next along, an important artery to note is this one coming off the subclavian, and you've got this on both sides. It's called the vertebral artery. So you've got the common carotid coming off the brachiocephalic trunk on the right side, and you've got the subclavians on either side, and you've got the vertebral artery which comes off the subclavian. So you can see the course of this artery. It runs up through the transverse foramen of the cervical vertebra. So you can see this transverse process here, and you can see this artery running up alongside the vertebral vein through the transverse foramen. So the vertebral artery runs up and it meets the basilar artery to join the circle of Willis and supplies the posterior parts of the brain. So that's the vertebral artery which comes off the subclavian. So I'm just going to follow this course of the subclavian artery, and I'll just show you what that extends down to. So the subclavian artery, you can see it running here underneath the clavicle, and that's why it's called the subclavian. So sub meaning under, and clavian referring to the clavicle, so it runs underneath the clavicle. So the subclavian artery becomes the axillary artery, and it becomes the axillary artery at the level of the lateral margin of the first rib. So the axillary artery runs here. So the axilla refers to the armpit, so it runs in the armpit region. So if we just follow it down, so you can see the artery running down the humerus. So this artery is the brachial artery, and the brachial artery then splits into two. So you've got the radial artery and the ulnar artery. So the radial, remember, radial is lateral in the anatomical position, so the radius is lateral, and the ulnar bone is medial. So often in clinical medicine you'll hear the words radial and ulnar referring to lateral and medial, because in the anatomical position the radius is lateral and the ulnar is medial. So the radial artery runs along the radius and is lateral and is on the thumb side, and the ulnar artery runs along the ulnar side and is medial and is on the side of the little finger. So following the artery a little bit further down, we can see the blood supply of the hand, and you can see these arches here. So this is the superficial palmar arch, and you've got the deep palmar arch. So the superficial arch is obviously close to the surface of the palm because it's superficial, and the deep palmar arch is deeper, obviously. So the superficial arch, as you can see, is further towards the fingertip, so it's more distal, and the deep palmar arch is more proximal. So I'm just going to return back to the centre of the body, back to the aorta, and we're going to follow it now down towards the abdomen and lower limbs. So the aorta can be divided into 5 sections. So the bit between the heart and this arch is called the ascending aorta. So you've got this ascending portion, and then you've got this arch shape, so this is the arch of the aorta, and then you've got the descending aorta, so the section from the arch of the aorta to the point where it divides into the common iliac arteries, so down here. So that's the descending aorta. And then you can divide it into the thoracic and abdominal aorta. So the thoracic aorta is the section of the aorta which is above the diaphragm. Aorta is the section below the diaphragm. So I've just added in the diaphragm, which separates the thoracic and abdominal parts of the aorta. So you can see it looping over the ascending, the arch, the descending portion, and you've got the thoracic aorta, which is above the diaphragm, and the abdominal aorta, which is below the diaphragm. So just looking at the abdominal section of the aorta, you can see these 3 branches here, which are coming off it. I've removed a lot of the arteries here because it makes it a bit more complicated, so I've left some of the main branches of the aorta, but I'll be covering the other branches in tutorials on the abdominal organs. So this top branch here is the celiac axis, and it has 3 branches. It's got the common hepatic artery, the left gastric artery, and the splenic artery. The branch below is called the superior mesenteric artery, and the branch below that, which comes off the aorta, is the inferior mesenteric artery. So the celiac axis supplies foregut structures, the superior mesenteric artery supplies midgut structures, and the inferior mesenteric artery supplies hindgut structures. So here you've got another bifurcation. So this is the bifurcation of the descending aorta, and this occurs at approximately the level of the L4 vertebra, so the 4th lumbar vertebra. And this splits into the common iliac arteries. So you've got the right and left common iliac artery. This then splits into just like the carotid arteries, it splits into the external and the internal iliac arteries. So just quickly to give you some perspective on whereabouts we are in relation to other structures, I'll just put in the bladder. So you can see where the bladder sits in relation to the bifurcation. You can see the kidneys, and I'll just show you in relation to surface anatomy. So you can see the umbilicus, and this sits at around the level of L3 to L5 vertebra, so approximate, very close to where the aorta bifurcates. So just going back to the external iliac arteries, which come off the common iliac, they then become the femoral arteries at roughly the level of the head of the femur. So you've got the femoral arteries which run down the length of the femur on both sides. So we're now at the level of the knee. External iliac arteries which come off the common iliac. They then become the femoral arteries at roughly the level of the head of the femur. So you've got the femoral arteries which run down the length of the femur on both sides. So we're now at the level of the knee, and I'm just going to rotate this model so we can look at the back of the knee. So you've got
Hold on. Let me pause and reshare because it's chopping up. That's better.
Artery supplies hindgut structures. So here you've got another bifurcation. So this is the bifurcation of the descending aorta, and this occurs at approximately the level of the L4 vertebra, so the fourth lumbar vertebra. And this splits into the common iliac arteries. So you've got the right and left common iliac artery. This then splits into just like the carotid arteries, it splits into the external and the internal iliac arteries. So just quickly to give you some perspective on whereabouts we are in relation to other structures, I'll just put in the bladder, so you can see where the bladder sits in relation to the bifurcation. You can see the kidneys, and I'll just show you in relation to surface anatomy, so you can see the umbilicus.
Hold on. Is it again?
And abdominal aorta. So the thoracic aorta is the section of the aorta which is above the diaphragm. Aorta is the section below the diaphragm. So I've just added in the diaphragm, which separates the thoracic and abdominal parts of the aorta. So you can see it looping over the ascending, the arch, the parts of the aorta. So you can see it looping over the ascending, the arch, the descending portion, and you've got the thoracic aorta, which is above the diaphragm, and the abdominal aorta, which is below the diaphragm. So just looking at the abdominal section of the aorta, you can see these three branches here, which are coming off it. I've removed a lot of the arteries here because it makes it a bit more complicated, so I've left some of the main branches of the aorta, but I'll be covering the other branches in tutorials on the abdominal organs. So this top branch here is the celiac axis, and it has three branches. It's got the common hepatic artery, the left gastric artery, and the splenic artery. The branch below is called the superior mesenteric artery, and the branch below that, which comes off the aorta, is the inferior mesenteric artery. So the celiac axis supplies foregut structures, the superior mesenteric artery supplies midgut structures, and the inferior mesenteric artery supplies hindgut structures. So here you've got another bifurcation. So this is the bifurcation of the descending aorta, and this occurs at approximately the level of the L4 vertebra, so the fourth lumbar vertebra. And this splits into the common iliac arteries. So you've got the right and left common iliac artery. This then splits into just like the carotid arteries, it splits into the external and the internal iliac arteries. So just quickly to give you some perspective on whereabouts we are in relation to other structures, I'll just put in the bladder, so you can see where the bladder sits in relation to the bifurcation. You can see the kidneys, and I'll just show you in relation to surface anatomy, so you can see the umbilicus, and this sits at around the level of L3 to L5 vertebra, so approximate, very close to where the aorta bifurcates. So just going back to the external iliac arteries, which come off the common iliac, they then become the femoral arteries at roughly the level of the head of the femur. So you've got the femoral arteries which run down the length of the femur, on both sides. So we're now at the level of the knee. And I'm just going to rotate this model so we can look at the back of the knee. So we've got the femoral artery here running down, and it becomes the popliteal artery. So that this area at the back of the knee, this bit at the back of the knee is called the popliteal fossa. So this artery is called the popliteal artery. So the popliteal artery then splits into a couple of branches. So you've got the anterior tibial artery, which branches off from the popliteal artery and runs down the course of the tibia on the anterior aspect. So here we're looking at the front, at the front of the body. So the anterior surface of the tibia, and at the back. So you can see here the popliteal. Just zoom in a bit more. So the popliteal artery branches off, and you can see it winding around here, just underneath the tibia, to form the anterior tibial. And then at the back, you've got two branches. You've got the posterior tibial. So the popliteal artery splits into the posterior tibial here. Posterior tibial artery runs down the posterior surface of the tibia, and you've got the peroneal artery, which runs laterally on the posterior surface. So just to recap, you've got the popliteal artery, which branches off into the anterior tibial, which winds around onto the anterior surface of the tibia, and you've got the posterior tibial, which descends along the posterior surface of the tibia, and the peroneal artery. So just moving down to the foot, you can see this arterial arch on the foot, which forms from the anterior tibial artery. So in the feet, you've got this artery here, which is the arcuate artery, and you've got this artery here, which is the dorsalis pedis artery. And this is important because in a vascular examination, you palpate this pulse. So this pulse, if I just put in the muscular system, you'll be able to see this tendon here, which runs up and extends the big toe. So this is the extensor hallucis longus tendon, and the dorsalis pedis artery is just lateral to the tendon of the tendon of the extensor hallucis longus. So those are the arteries of the body, some of the important ones that you need to know. And I'm just quickly going to show you some of the pulses that are palpable. So in a vascular examination, you palpate a few pulses. You palpate one at the neck, so the carotid pulse. So you can see that this is palpable between these muscles here, so the carotid artery. At the arm, there are two pulses you palpate, one just at the elbow. So you've got the brachial artery, which you palpate here, medial to the biceps tendon, and at the wrist you palpate the radial artery here. You can see the femoral artery passing through here quite superficially, so this pulse is also palpable, and this you can feel between the midpoint of the pubic symphysis and the anterior superior iliac spine. So this is the femoral pulse you feel here between the pubic symphysis and the anterior superior iliac spine. Behind the knee you can palpate the popliteal pulse. So this you can feel between the head of the gastrocnemius muscle, and in the feet you can palpate the posterior tibial pulse, which runs just behind the medial malleolus of the tibia. And as I mentioned before, you can palpate the dorsalis pedis artery, which runs lateral to the tendon of the extensor hallucis longus. So those are the arteries, some of the important arteries that you need to remember in the body.
So remember that both of those videos are posted, right? So if you want to review them, you're more than welcome to do so. And normally what I do is I would break and give you guys some time to look at the material in the lab manual, but in the interest of time, what I'm going to do is go right into the PowerPoint and discuss the arteries and point out to you what you need to know. And the reason for that is that we don't have physical models for you guys to work with at your home, right? So what we want to do is get you familiar with what you'll see on the practical exam so that when it pops up, it's not alien to you, all right? So we're going to discuss the arteries which carry blood away from the heart, right? Remember that when we name these vessels, we name them based on either the organ that they serve or the region of the body that they run through, okay? So you're looking here at a diagram of the major arteries, and this is from your lab manual. We can start at the heart, which would be approximately here. Let's actually draw the heart in, sort of sketch it so that you've got an idea of where it's located. Hold on. Wait a minute. Let me bump out. Let's see here. Yes, keep it. Let's see what you got. Oh, okay, hold on. Let's pause and reshare. There we go. All right, that should work. Yeah, oops, close that up. Come on. There we go. And vessels. All right, so now you should be able to see. There we go. Now, can everybody see the diagram? You good? Okay. So we start the heart, right? That's to represent the heart. And that's the aorta. That's the ascending aorta, and that's the aortic arch. And the first vessel to come off the ascending aorta is going to be the brachiocephalic artery. Brachiocephalic means arm head, all right, which means that it has a branch that's going to go to the head. That's the cephalic branch, and the branch is going to go to the arm, all right? So what happens is that the branch that goes to the arm is going to first be the subclavian, and then it's going to become the axillary, and then in the arm is going to become the brachial, all right? And then this other split off of this brachiocephalic branch, that's the right common carotid, and that's going to branch into the right internal carotid, which is going to serve the brain, and then the external carotid, which is going to serve the face and the head, all right? So whenever you see the term common, what you know, let me use laser pointer here, what you know with the word common is that the next thing to come is going to be vessels that branch off it that have the same name, right? Right? Common carotid gives you an internal carotid and an external carotid. That's the external, that's the internal, okay? So that's another vessel naming criteria that'll help you guys. Then as we move across the aortic arch, we come here, okay? And this is the left common carotid, which is going to split into the left external and the left internal carotid. Again, the internal carotid serving the brain, and the external carotid is going to serve the head and the face. As we continue, we end up with left subclavian, which will become left axillary, which will become left brachial, okay? In the armpit, it's axillary. In the arm, it's brachial. And up under the collarbone, it is subclavian, which means under the collarbone, all right? Now, there's some other arteries here, all right? Left internal thoracic is going to serve structures in the chest cavity, in the chest wall, okay, such as the intercostal muscles, okay? It's going to branch into a posterior and an anterior thoracic artery. The anterior thoracic artery, if you were in lab, would only be visible on the back of the chest and abdomen plate, right? The anterior thoracic would be on the back of the chest abdomen plate. The posterior internal thoracic is not visible in most of our models, okay? And then you've got the vertebrals, all right? The left and right vertebral arteries are going to go where? Well, they're going to go up through the cervical spine, through the transverse foramina, and head up towards the brain, where they will join a structure called the circle of Willis, okay? So the vertebral arteries head up towards the head, all right? Now, going down, right, you have the descending aorta, which we could also call the thoracic aorta, and then it's going to hit the diaphragm, and at that point it becomes the abdominal aorta, all right? Now, immediately under the abdominal aorta is a little structure called the celiac trunk, which has 3 branches coming off of it, okay? On the left side, it has the splenic artery. In the middle, it has the left gastric, and then on the right side, it has the hepatic artery. So the hepatic artery is going to serve the liver, the left gastric is going to serve the stomach, and the splenic artery is going to serve the spleen. You'll head down a little further, and then you're going to see a branch called the superior mesenteric, which is going to serve the connective tissue that attaches the digestive system up from the descending and sigmoid colon and the rectum and the anus. So everything previous to that is going to be served by the superior mesenteric. So that would be the entire small intestine, portions of the stomach, and the ascending and transverse colon and the cecum. All right. Below that are going to be the renal arteries and the adrenal arteries. The adrenal arteries are going to serve the adrenal glands, which are on top of each kidney, and the renal arteries are going to serve the kidneys themselves. And then you're going to see below that the gonadal arteries, which are going to descend all the way down to the testes in the male or down to the ovaries in the female. And then you're going to see the inferior mesenteric artery, which is going to serve the descending colon, the sigmoid colon, the rectum, and the anus. Then we come down here, abdominal aorta is going to split into the right and left common iliacs. And again, iliac gets its name from the ilium of the pelvic girdle, which is the big fan-shaped portion of the os coxa. And then that'll split, see the word common again, into the internal and external iliacs on the right and the left side. So the internal iliac is going to serve structures in the pelvic girdle, such as reproductive and urinary structures, while the external iliac is going to continue as the femoral artery in the thigh, and then the popliteal artery behind the knee, and that's going to split into the anterior and posterior tibial under the knee, and the fibular under the knee. And then in the foot, we're going to form the dorsalis pedis and the digital arteries, which serve the toes. In the arm, up here, the brachial artery is going to split and form the radial and the ulnar and the median arteries. Okay? Radial artery runs along the radius of the forearm. The medial artery is going to run along the ulna, right? And then they're going to form the superficial and deep palmar arches in the palm of the hand, and off of those will come the digital arteries that'll go into the fingers. Okay? So we're going to take a deeper look at each of these. All right? We start up here. This is the brown torso, and this is we're looking here at the thoracic cavity. Specifically, we're looking in what would be the pericardial cavity with the pericardial sac stripped off. And we're asking, what are each of these vessels, right? Well, this is the ascending aorta. This is the aortic arch, and this is the descending aorta. All right. Now, coming off the base of the aorta are two vessels that supply blood to the heart itself, and these are the right and the left coronary arteries. Coronary means crown, right? So around the crown of the heart, you have the coronary circulation. Okay. The left coronary artery will split into the anterior interventricular here, okay, and then the circumflex will bring that around to the back of the heart, and then over here we have the right coronary artery, which gives off the right marginal artery, and then also comes around to the back of the heart to supply the muscles in the back, okay? Remember that this is the pulmonary trunk, right? These are the atria, okay? And these are the ventricles. So this would be the right ventricle over here, and this would be the left ventricle over there, okay? All right. Over here, what do we have? Well, we have the subclavian artery, the right subclavian artery here, all right? We have the right common carotid, okay? Over here we have the right, or the, sorry, not right, but just the brachiocephalic artery. There's only one, and that splits into the common carotid and the right subclavian. And then over here we have the left common carotid, and we have the left subclavian, okay? Note that your collarbone would be right about there and there, okay? So those are the big branches coming off the aortic arch, right? ABC, right? We've got the anterior, we've got the brachiocephalic, we have the common carotid, and we have the subclavian, okay? All right. What do we have here? Well, this is brachiocephalic, right? This is right subclavian. This is right common carotid, okay? And this is still right common carotid. But right under the lower jaw, it's going to split into the internal carotid that's going to go into the brain, and the external carotid that's going to go up to the head and the face, okay? Over here, we have the left common carotid, and this is the left subclavian here, okay? What do we have here? This is right subclavian, and this is right common carotid. Again, the split doesn't come until about here, okay? Okay, this is the underside of the brain. You probably remember this from A&P 1. And what you're looking at here, this little ring is called the circle of Willis, okay? So what feeds into the circle of Willis? Well, these two guys are the vertebral arteries coming up through the transverse foramina of the cervical vertebrae and forming the basilar artery right here, okay? And then what we have is the posterior communicating arteries. There's one, there's the other. And then these guys here, these little points where blood comes in, here and over here, this is where the internal carotids feed into the circle of Willis, okay? And this is the anterior communicating artery, okay? These coming out of here are the anterior cerebrals, all right? And these at back here are the posterior cerebrals. This represents collateral circulation. So the idea is that if you block something in the circle of Willis, the blood can flow back around the block and come in the other side and still perfuse the brain. So it's not foolproof, but it works pretty well, right? And the reason you want that type of circulatory pattern is because the brain is a vital organ, all right? To orient you, what are some of the other structures? These are the olfactory bulbs and the olfactory tracts. That's the mammillary body, right? There's the cerebellum, right? And there's portions of the brainstem. So you've got this sort of resting on top of the pons, right? And then up here, or below here, you've got medulla, and then midbrain is going to be tucked really kind of under all of this material. You're looking here down on the floor of the skull, where this is the front and this is the back, okay? And this area here is showing you where the internal carotid artery comes into the circle of Willis, all right? And it's through an opening called the carotid canal, all right, in the underside of the skull. And this brings blood to the brain. So there's 4 vessels that bring blood to the brain, right? The right and left vertebrals and the right and left internal carotid arteries, okay? Very important. What you're looking at here is thoracic cavity. We've got descending aorta. These guys back here are the posterior intercostals. Intercostals means between the ribs, okay? Posterior intercostals. Then over here, this blue vessel is a pulmonary artery, right? And the reason it's blue is because in the pulmonary circulation, the arteries are blue and the veins are red. And the reason for that is that the arteries are carrying oxygen-poor blood away from the heart and towards the lungs, where it's going to get oxygenated and then return to the heart through the pulmonary veins, these guys, and into the left atrium, right? Okay. So, over here, what's this? This is the anterior internal thoracic, right? And what are these guys coming off? These are, again, intercostals. These are anterior intercostals, okay? So anterior internal thoracic artery, this is the back of the chest plate, right? This would be the abdomen. There's the sternum. These are the true and then the false ribs, okay, and so on, okay? Over here, again, another view of thoracic and abdominal pelvic cavity. So now we can see a lot of stuff, right? We can see ascending aorta, aortic arch, descending, also in this region, thoracic aorta, and abdominal aorta, which you could also call descending aorta, right? So what are the branches? Under here, brachiocephalic, right subclavian, right common carotid, left common carotid, left subclavian, all right? Back here, these are the posterior intercostals, okay? Posterior intercostal arteries. This is the diaphragm, of course. Under here, this guy is the phrenic artery, and he serves the diaphragm. Phrenic, P-H-R-E-N-I-C. This is the celiac trunk, okay? This is going to serve the liver, so this is the hepatic artery. This is the left gastric artery serving the stomach. And this over here is the splenic artery serving the spleen, which is under your diaphragm at the tail of your pancreas on the left-hand side. All right? This is superior mesenteric. And right here, these are the renals, right? There is the right renal, and there's the left renal artery. And then if you look real close, you can see on this side the left adrenal artery. And this is the adrenal gland here in yellow. And this is the renal gland, the kidney, here in dark brown. Okay? Moving down, superior mesenteric, right? Serving the digestive system from the stomach all the way to the descending colon, all right? But it does not serve anything from the descending colon on, right? So it does not serve the descending colon, the sigmoid colon, the rectum, and the anus, all right? And you might, if you think back, remember that there are connective tissue membranes that attach the digestive system to the wall of the abdominal pelvic cavity, and that's called mesentery, all right? And it serves as a passageway for nerves and blood vessels and lymphatics to go back and forth from the digestive system to other organ systems. All right. As we go down, these are the gonadals. All right. A lot of people think these are the renals, but they're not. They're the gonadals, because if you follow, right, we're going all the way down to paired structures in the inguinal region. Well, the only paired structures in the inguinal region are the gonads, which are the testes in the male and the ovaries in the female. On this side, they've just cut that artery. Okay. So the reason that they're way up here is because the testes and the ovaries actually start in development real close to this area of the aorta, and then they drop, and their blood supply has to come with them as they do so. And the testes actually drop even further than the ovaries, going through something called the inguinal canal, and eventually down into the scrotum, guided by my favorite tendon in the body, the gubernaculum. Okay? This is the inferior mesenteric, and it serves the descending and sigmoid colon and the rectum and the anus. All right. This is the common iliac, right and left. This is the right common iliac, the left. Okay. This is the external iliac, right external iliac, and this is the right internal iliac. This is the the left external iliac and the left internal iliac. Okay. So now, if we look over here, right, we can see a few other structures. There's phrenic artery. We've touched on that before. Superior mesenteric, right renal, left adrenal, sometimes called suprarenal, okay, because it's above the renal organ, which is the kidney. There are the right and left gonadals, right, and there's the inferior mesenteric, okay. The three indicated vessels. A is going to be the hepatic artery, B is the left gastric, and C is the splenic artery. Okay, splenic because it serves the spleen, hepatic because it serves the liver, and gastric because it serves the stomach. Okay, and those are the three branches of the celiac trunk. Right. All right. Here, what we've done is we've put the intestines partially back, right? The small intestine is missing, but the large intestine is visible with the exception of the transverse colon, which would be here, and the front portion of the cecum. This is the other end of the superior mesenteric artery, and you can see as it comes out here, it's going to serve ascending colon. It serves transverse colon, even though that's been removed, okay? And it's also going to serve stomach, okay, and small intestine, because you can't see those branches because they've been, the small intestine's been removed, right? This down here is inferior mesenteric, all right, serving the descending colon, the sigmoid colon, the rectum, and the anus back here, all right? Okay. Here we're looking at the back of what we were looking at the front of in this picture, okay? So this is the front here, right? And then we come around and we've got the back here, all right? So what's in the back? Well, over here, this is the splenic artery. Why? Because this would be the left over in this direction, okay? And the right would be over here, which makes B the common hepatic artery. This is superior mesenteric, and this is inferior mesenteric. And of course, we know that they pop out on the other side, and you can see them here, right? There's superior, and there's inferior mesenteric. Okay? Now, you might wonder, what are some of these other structures? This is duodenum, right? And this right here is bile duct, right? Which comes off the cystic duct, which comes out of the gallbladder. And we'll learn more about that when we get to the digestive system.
What was that?
A was the splenic artery. Okay, spleen's going to be over here because we're looking at the back. Okay, this is the back of this. Okay, all right. This is the liver. Okay, this is the gallbladder. This is the cystic duct. This is the bile duct. This is the common hepatic duct, and this is the right and the left hepatic duct. Now, those will be important when we get to the digestive system, all right? What we want to note here are these other vessels, right? This is the hepatic artery. We know that that's coming off of the celiac trunk. We'll get to this guy later, but this is the hepatic portal vein, and he brings blood from the digestive system to the liver. And inside the liver, it mixes with the blood from the hepatic artery. And then this is the inferior vena cava, okay? And like I said, when we hit veins, you'll see more of that, but that's hepatic artery right there, okay? All right, over here, we have the lower part of the brown torso, but we have two views, right? On the right side, we have the deep view, and on the left side, we have the superficial view, all right? So these structures are closer to the surface, and these structures are deeper in, and you can tell because muscle's been pulled off here, all right? So this artery over here, this is the femoral artery, all right? Named because it runs through the femur, all right? These structures are deeper in, all right? These are branches that come off the external iliac, all right? And I don't think you need to know these deeper guys, okay? All right. Remember here, right, that in the arm and the leg models that the yellow represent nerves and the red represents arteries, and if there's any blue, that's going to represent a vein, okay? So we come over here to the arm. This is a right arm, right? We're looking at the forearm here. This is going to be the lateral side where the thumb is, and this is going to be the medial side where the little finger is. So this is the ulnar artery, right? And this is the radial artery. This is the median artery. This is the palmar arch. And these guys going into each finger, these are the digital arteries, the digitals, okay? So you can see how it kind of splits off of the brachial, right, and comes out and does its thing. This is a view, medial view, of the left hip and thigh, all right? You're looking from right to left, from medial to lateral, okay? This is the vertebral column. This is the cauda equina, right? And then this big honker here is the sciatic nerve, all right? You don't need to know those for this, but just orienting you. These are lumbar vertebrae here. So what is this guy? Well, this is going to be the common iliac. This guy here splitting is the internal iliac, and this guy out here is the external iliac, which becomes the femoral when it goes into the thigh. Okay, so it's like sometimes how streets change their names. An example here of the arteries changing their names, right, as they go from one part of the body to the other, even so it's the same vessel. Okay, here's anterior hip and thigh. This is a left thigh, right? So A is common iliac. This would be internal iliac. And this would be femoral, right? Because now we're in the thigh. We've gone through the inguinal ring here, okay? And once we do that, we're in the thigh proper, right? Up here, this would be the external iliac, but down here, it's the femoral. We look at the back of the knee. This is a left knee, okay? This is the femoral artery. This is the popliteal artery running behind the knee, okay? C is the anterior tibial artery. So C is going to come from the back off of this guy, okay, and form the anterior tibial, and this is the posterior tibial, and this guy here is the fibular, and this continues as the posterior tibial, right? the posterior tibial is created as soon as the anterior tibial branches off, right? Now you might wonder, sometimes this is called the peroneal, right? But peroneal and fibular are the same thing, and I would accept either one, peroneal or fibular, if you have a fill in the blank, right? But I like fibular better because it tells me that it runs next to the fibula, which gives me a landmark, okay?
And that's
All
the
right.
case here, correct?
Yeah, you can use either one, okay? But just know that sometimes you'll see peroneal and sometimes you'll see fibular, and they mean the same thing, okay? Here, right, A is the anterior tibial, right? So if we were to walk backwards along A and then go back into the back of the leg, right, it would come out right here where C is indicating, right? So C is anterior tibial, and over here A is anterior tibial. And then this guy here on the top of the foot, this is the dorsalis pedis, okay? All right, so the next set of questions is asking you not to identify the vessel being pointed to, but to identify the artery that the vessel came from, okay? So these questions get a little bit tricky. So the way I approach these is I identify the vessel pointed at first, and then I go backwards and identify the feeder, okay? So A is the right subclavian. What does it branch off of? It branches off the brachiocephalic down here. B is the left subclavian, and it branches off of the aorta. Okay? Over here, all right? B is the right subclavian, and he branches off of the brachiocephalic. A is the right common carotid, and he branches off of the brachiocephalic. Okay? C is the left common carotid, and he branches off the aorta. And D is the subclavian, and he branches off of the aorta, the left subclavian. All right, so right subclavian, right common carotid, left subclavian, left common carotid. A and B branch off the brachiocephalic. C and D branch off of the aortic arch. Okay. Over here, common carotid, right? This is the common carotid. What does it branch off of? The right common carotid branches off of the brachiocephalic. The right subclavian also branches off of the brachiocephalic. Okay? This right here, this and this, right? These are the internal carotids, and they branch off of what? The common carotid. Okay, so A is the right internal carotid, so it branches off the right common carotid. This guy here is the vertebral artery. Okay, and the vertebral arteries branch off of the subclavian arteries. Okay? Over here, the right internal common carotid. What does it branch off of? The right common carotid. Okay, over here, these are the posterior intercostals, and they branch off of the thoracic aorta, right? This is the pulmonary artery, and it branches off of the pulmonary trunk, coming out of the right ventricle of the heart. Okay. Over here, this is anterior internal thoracic, all right? And it branches off the subclavian artery. Over here, we have right external iliac, and here we have right internal iliac, and they both branch off of the right common iliac. Okay. Over here, all right, we have the left gastric artery, and that branches off of this structure called the celiac trunk. And here we have the left gonadal artery, and it branches off of the descending aorta, or we could be more specific and say the abdominal aorta. Okay. Over here, we have the superior mesenteric, which branches off of the abdominal aorta. And this is the inferior mesenteric, which branches off the abdominal aorta. Okay. Over here, we have the splenic artery. Remember, we're looking at the back of this structure, and it branches off of the celiac trunk. And down here, we have the inferior mesenteric, and he branches off of the abdominal aorta. We have here the hepatic artery, and he branches off of the celiac trunk. Okay. This is the femoral artery, and he branches off of the external iliac, specifically in this case, the left external iliac, right? Over here, right, we have the subclavian artery, and he branches off of what? Well, we got to know what arm this is. This is a right arm. How can I tell? Well, this is the shoulder blade, right, the scapula, and this is the collarbone or clavicle, right? This is a right arm. So this guy, the right subclavian, is going to branch off of the brachiocephalic, okay? If it were the left subclavian, he would branch off of the aortic arch, right? And then this is the brachial artery, and he comes off of the axillary artery, which is right in the armpit, okay? All right, moving on. Here we have the ulnar artery, and he's coming off of the brachial artery, okay? Here we have the internal iliac, and he's coming off of the common iliac. Here we have the femoral artery, and he comes off of the external iliac. Here we have the popliteal artery here, and he's coming off of what? The femoral artery up here. This is the anterior tibial artery, and if we look back here, anterior tibial artery comes off of down here, right? This is going to be the popliteal, okay? All right, the three branches of the celiac trunk are the left gastric, the hepatic, and the splenic. At what point on the aorta do the right and left coronary arteries come off of? They come off the base of the aorta. The four major arteries that supply blood to the brain, the right and left vertebral arteries, and the right and left internal carotid arteries. From what arteries do the vertebrals come? They come from the subclavian. Okay? What is the name of the second artery to branch off of the aortic arch? Meaning, as we come from the ascending aorta into the aortic arch, the second branch is going to be the left common carotid. Which branch of the abdominal aorta supplies blood to the distal large intestine? That's the inferior mesenteric. Does the splenic artery only supply blood to the spleen? And the answer is no. It also gives blood to the pancreas and the stomach. Next, what vessels supply blood to the diaphragm? The phrenic arteries. And finally, what artery carries blood from the subclavian artery to the brachial artery? And that's the axillary artery. Next one. What artery carries blood from the femoral artery to the anterior and posterior tibial arteries? And that's the popliteal behind the knee. Next, which artery does the fibular artery come from? And that's the posterior tibial. Next, is the radial artery lateral or medial to the ulnar? It is lateral. Next, what artery supplies blood to the pelvic walls and a number of pelvic organs? And that is you could argue for the abdominal aorta, but they want to be more specific here, and we would say the internal iliacs, okay? And then finally, what color would a pulmonary artery have on a torso model? And the answer would be blue. Okay. For each of the following vessels, tell the organs or the region of the body that are supplied. Vertebral artery, brain, subclavian artery, ultimately to the arm and to the shoulder. Basilar artery, brain. Left gastric artery, stomach and esophagus. Splenic artery, spleen, stomach, and pancreas. Common hepatic artery, liver and the pylorus of the stomach and the pancreas. Superior mesenteric artery, duodenum, transverse colon, and pancreas. Inferior mesenteric artery, the large intestine from the left colic flexure to the rectum, right? So that would be the descending and sigmoid colon, the rectum, and the anus, okay? The popliteal artery, the knee joint, and the muscles of the thigh and the calf, okay? The internal iliac artery, the brain. The internal iliac artery, not the brain. That's going to be the pelvic organs, including the reproductive and the urinary. Internal carotid artery is going to be the brain. The external carotid artery is the face, the scalp, and the skull, as well as the meninges that surround the brain. The internal thoracic artery, the anterior chest wall, and the breasts. And the suprarenal artery is going to be the adrenal glands. Okay? So, we stop here. This marks the end of what you're responsible for on the practical exam. Next week, we will have review for the practical exam during the lab time. And then the practical exam, I'm going to be set to be due Sunday night by 11 o'clock p.m. Okay? So what I want you guys to do now is, if you have any questions, you can ask them. Otherwise, I want you to go ahead and take the quiz, the lab quiz, which remember is over in 1242, right, and is open and available to take. And remember that that's going to be over the heart and the EKG, right? And if there are no other questions, I will bump out and join you guys at 2:30. Does anybody have any questions for me?
I have a question.
Yes.
So the first test for the lab will be over blood, the heart, and the blood vessels, correct?
Just the arteries.
Oh, the arteries, just the arteries. Okay.
Yeah, exactly. Mm-hmm.
Okay, thank you.
Yeah, and what I'll have for you guys is a sort of a practical. Okay, so I'll ask you some questions, and you'll get the feel for what type of questions are going to be on the actual practical, so that you're prepared. And then the actual practical will be due by 11 p.m. Sunday. Okay.
Now, a quick question here. I have a question for you.
Yes.
So my question is, for next week, we will not have a lecture, right?
Yeah, it won't be a strictly speaking lecture, right? What it'll be is a review session for the exam and for the lab practical.
So we have an exam and a lab practical next week?
Yes, you have a double header. It's the only time you're having a double header. Okay.
And which one would that be over? That'll be over the cardiovascular system for A and B and...
Right. So the exam 1 is going to be over blood and heart only. Okay. That's lecture exam 1. Lab exam 1 is blood, heart, EKG, and arteries. Everybody cool? We good? All right. I will see you guys at 2:30.